Butabika Hospital is Uganda's national mental referral hospital. Started in 1955, Butabika was put up to primarily cater for mental health in the country. However, the rise in addiction problems caused the management at Butabika to include an alcohol and drugs unit during Butabika's remodeling in 2001. The ADU is a 30-bed unit.
Eventually I started taking alcohol in P5. Yeah. Then the using of heavy drugs I started in Form 2. Like I could see snakes climbing all over my body. I could see insects, very huge insects. Like there's a time when I felt a mosquito entering into my ears. I said, what's wrong with me? So I started seeing many things, different things that I've never seen in the world. So that's the effect of taking drugs.
Addiction as a problem is on the increase the world over. It's not only unique to this country, but what we see that in this country is also is rising very fast. And among the factors is one that we have a fast increasing population. So that means we're also getting more and more people that are addicted to various forms of drugs. The other factors are that we have drugs that are widely available. Things like marijuana, things like alcohol, tobacco are widely available. So when they're available, people very, very easily access them. We also have problems that legislation has been very, very weak in this country. Where it exists, the enforcement is sometimes poor, so we get a lot of drugs coming in. But also those, the local available drugs like marijuana, they are growing, their availability, their sale is very, very easy. So it makes people to very, very easily access these substances.
At first we are seeing people who were abusing more of the alcohol, marijuana, tobacco. But now people are abusing the hard stuff. We are getting more numbers abusing the hard stuff and people abusing multiple substances. These days it's rare to get a patient who has only one substance being abused. Most of them are abusing more than one. And even things that we had never heard of in the beginning. Things like Kuba, I don't know whether it is modernized marijuana, Mirage, those things used not to be there. Then the shisha, we don't know what they put there.
I was admitted to Butabika on 27th March because of my drinking. I couldn't stop my drinking. Like I couldn't cut down my drinking and the use of drugs. I was using Kuba, marijuana, cigarettes, I was also using alcohol.
Treatment for people that are addicted to drugs is not a simple thing. The way we treat these people is not like the way we treat people with malaria, where you give somebody treatment and they go out and probably never to come to you. Addiction is, by definition, a chronic relapsing disorder of the brain. So even when we give treatment, we have to continue the support for a very, very long time.
You know, it is seen that when people take drugs or alcohol or they become addicts, it's very difficult for them to deal by themselves at home. So many people have failed out. What will happen if one tries to withdraw by himself if he's an alcoholic or drug addict? What will happen is they'll get very severe withdrawal symptoms, which they can't deal with in the community. Some people die. Some people go into alcoholic comas. Some people start shivering and then get tremors. And some people get other features of mental illness. Actually, they tend instead to go psychotic. So what happens is when they come in the hospital, we are specialized in drug addiction treatment. We do them specialized treatment and then handle them and then give them medication. Actually, this is chemotherapy. Beyond the psychotherapy, we do chemotherapy, which are medication tablets, which helps them to withdraw slowly and also help them from getting very dangerous withdrawal symptoms. So, and they are under the care of nurses 24 hours, so they are being monitored every now and then to help, which is not found outside.
Treating an addiction patient takes the total cooperation of family, community, and the doctors. However, the medical personnel at Butabika are hindered in their work when family members are unwilling to participate in the patient's recovery and the patient is stigmatized in their community upon discharge.
We would work as a team with the parents, but most parents, by the time they bring these people here, they're already fed up. So even if you want to bring them on board, it becomes a challenge, bringing these people on board to come and help. Yet if these parents were willing, maybe something better would have been done. The biggest cause of the relapse that we have identified is lack of the social support. As I said, the family is already tired. So you send this person, has his challenges, goes back home, and there is no support. Because not every time that somebody will relapse because wants the substance, but maybe challenges he has got. So if you maybe address those challenges, you are able to help this person.
We can't discharge the patient from here without calling their relatives, without knowing where he's going, because it is also very important to know where he's going, because at times they end up, the people whom he has been staying with, they are not going to change. So these people still have they do a big job. They talk to the person who is going, they talk to the people whom the patient is going with to see how they can go about with what they have been doing, the behaviors. Because this is the very place they are landlords, they are not going to shift. Like an example, a patient is staying from where you get it. He's not going to shift to leave the friends whom he has been doing whom he has been abusing his drugs and what have you. That's why these people are doing a big job. They talk to them to see how they are going to handle when you decide, how are you going to start, because these are the very people whom you are going to leave. And it is you now to decide what to do. They do their part, and those who have failed to listen or to understand what they have been telling them within that very period, these are the very people who end up coming back here within a short period. But for us, we do our part.
I'm Stella Mlira.
Okay, Stella, what are you doing in Butabika today?
I've come to visit my brother. Yeah, he's a patient here.
What has he been admitted for?
Drugs, marijuana, Cuba, alcohol. Yeah.
Stella only got to know of her brother's sickness 2 years ago when his constant blackouts caused alarm, and she decided to intervene before it became too late.
But the wife was complaining too much. He used to abuse her, he used to beat her. He used also to spend all the nights on the streets, not even coming back home.
And have you interacted with your nieces and nephews? How has it affected them having their father use drugs?
For them, they lost hope. They lost hope in him one day. They just let him do his own things.
How old are they?
The nephews? They are youths.
They're
in 20s.
20s?
Yeah.
Because we're not looking at addiction as a problem. But when you look at violence in families, you look at people who are killing others in families, it's as a result of drug abuse and alcoholism. You get? Then poverty in families is a result of that. So if someone knows that I'm drinking alcohol, but my style of drinking alcohol is not good, you have other habitual disorders, you leave the bar, you come and fight at home. When your children hear you, they start running, you don't relate with your family, then you have a problem with alcohol. You know that when you get a salary, until the last coin is out of the pocket, you will never leave the bar. You have a problem with alcohol. So we are not looking just at mental illness. We are looking at other factors. Yes. You're indulging into immorality. All the women around you, they are all your women. All women are yours. Alcohol is not yours. Sure. You just need to quit and yes. You come here and we give you behavioral change skills.
When he came here, he was really small. He had no appetite. He was looking very bad, but now he's okay. He's now big. He has put on weight, he's eating. His life is really encouraging us.
You've been told about relapses by the therapist. What structure do you have for him when he gets out so that he doesn't relapse?
After here, we are planning for him to get a job. And if anything happens, we encourage him to come back for AA, for treatment, for checkups. Yes.
Addiction is a problem that feeds on a whole bunch of other problems, both medical and social. It takes a dedicated team of physicians to meet the patient at different levels of recovery, even after the patient has left the hospital.
The team is quite big. It is composed of the doctors. It's composed of the doctors. Some are specialized like psychiatrists. We have psychologists, we have social workers, we have occupational therapists, we have nurses, we have counselors.
Majorly when patients come, most of the times they go through the mental health clinic, and that is where they see psychiatrists and psychiatric clinic officers. So we as a student, me as a student nurse, how I come in, I'm always at the wards, and that's if a patient is to be admitted, I'm entitled to admit this patient because it's an order from the psychiatrist. So after that, I'm entitled to do the documented things that I'm supposed to follow, like giving medication, then taking the patient to where he or she's supposed to be.
We give them the treatment. We help them in each and everything because they are here, they have to eat.
There is a point where patients have gone through a detox. After detox, by them giving medication and observation, patient is given some time to calm down and possibly work on the cognitive behavior part of it. So I come in the process. I come in to work on the cognitive behavior. I come in to make a patient understand he has a problem, and I come in to make a patient accept the environment and accept he has to be in a treatment program, because some of them are resistant. They can take medication and they don't always want to continue. So I come in by doing a lot of clinical interventions like motivation interviewing skills, and then there are so many points that I also come in by also integrating and doing family therapy, calling the parents, talking with their parents, and understanding that they have a problem, so that also their parents understand them. Yeah.
I do assessment when client is forwarded to me by a psychiatric nurse. I do my own assessment, not basing, though I pass through the files on what the person has flagged, I have to do my own assessment. So after doing my own assessment, I see where the problem is. Is it the drugs? Is it other behavioral factors? So I deal with behavior factors. As Grace said, when there's some kind of resistance, we do motivation interviewing to make sure that the client comes in terms with his problem. Then engaging in parents, we do clerk also the parents. After clerking the parents, we also teach them motivation interviewing still, because there are those ones who deny that their people don't have the problem when you bring the problem forward. So we deal with behavior change, help them cope with the problem they are facing, the craving, and give them other skills to pass through the addiction phase.
So that big composition of a team comes together to help people. But we have also diversified, because besides the core team, we have other people that must be there to support other existing problems. For instance, you might have somebody with an addiction problem but has also got HIV/AIDS, has high blood pressure, has diabetes, so you must be able to help with all these other problems. So this is actually the beauty of having a facility like this one, ADU in Butabika, which is attached to a main hospital. So we are able to attend to all the multiple problems that our clients really come with. Requires an X-ray, we are able to do it. Requires HIV/AIDS intervention, we are able to do that. Requires to get skills, we are able to do that using the various departments.
Unlike before, Butabika does not only cater for mental illness patients. An outpatient clinic has since been opened to cater for even the most basic medical problems like stomach ache. Despite all this development, Butabika still faces a number of challenges, especially in the treatment of addiction patients.
And if we can handle here, then believe me or not, we will conquer that failure. These are some feelings. It's just a feeling. Just learn how to control the food. Because not every time you feel you want to have fun, you must have fun. It's just the body that demands.
These drugs you are using these drugs, you are also losing the memory, you understand? You lose the memory, you drop out of school, you lose your family, you can't even lose your life because of drugs. I've seen many people on streets, they're dealing with drugs so much. They're using drugs all the time, every time, and they're youths like me, you understand? Yeah.
We are grossly understaffed because at a unit like ADU here, where I have like, for all the 24-hour shift, I have like 6 nurses. Actually, I would be happier to have like 20 nurses. So I have 1/3 of my requirement on this ward. I need probably 2 clinical psychologists to work here alone, but the 2 clinical psychologists I have work in the entire hospital. I need 2 specialist doctors here, psychiatrists. I'm the only one, for example, and now I'm busy with lots of other things, so that creates a lot of challenges.
Then the other challenge is the small place we have, because sometimes you see a patient you're telling, I don't have space, really needs help, but because this ward doesn't have floor cases, once the 24 beds are full, that's enough. So it really hurts you as a therapist, knowing that this person I'm sending really would remain here. We end up taking patients on their acute wards to be managed from there, because right now we can't admit females. We still send them to the female wards. And we encourage the government, they should sponsor us to go out there and do more work, so that they can reduce on the expenditure here in the hospital, because they spend a lot on medicine, food. So if they could put that cash in us to go out there and kill that, like if you want to prevent snakes from your house, you plant tobacco, because tobacco and snakes, they don't deal. So even us have to go there and plant the tobacco, like, and kill, before the snake comes in.
We have often been told that prevention is better than cure, and indeed preventative medicine is recommended by physicians. Butabika Hospital is the leading health center for addiction treatment not only in Uganda but in the region as well, with patients coming from as far as Congo and South Sudan. And as an added bonus, treatment is offered at no cost. In the few years that the ADU has been open, a 40% success rate has been registered. This means that at least in every 5 patients, 2 successfully recover. However, this number is still very low, and the hospital needs support from all stakeholders to be able to deal with the drug abuse problem that is threatening our society and future as a nation.
We have a program of restructuring the entire hospital. Actually, it was already started. We are just waiting for the blessing from public service, government as such, to approve a proposed structure. And if they do, then we shall be in a better position to handle, we shall get more staff and be able to handle our patients even better.